team one. Allow them to pick the first category. All right, after I read the question, then you can buzzer. Well, whoever buzzers first, we'll let them answer. And we'll try to go by traditional Jeopardy rules, minus or plus whatever our point system is. And then we'll go from there. And then you'll start picking your categories. Whoever gets it right, we'll keep going from there. Okay?
You have to say it in the form of a question.
Everything should be in the form of a question, I think. What is and what if, that kind of stuff. I try to keep it as clean as you could.
I don't think I've ever really
These
watched
old
Jeopardy.
guys can't see that.
Me neither.
Hold on, it's gonna.
Oh, okay.
On
Right.
that, the speaker doesn't work. Oh, it does work. Yes.
So, I have a question.
That's good.
I've never
I
really
spent
watched
way too much
Jeopardy.
time on this.
Or is it whoever?
Whoever hits the buzzer, you get to pick your
Whoever-
category.
category.
Y'all got, we got this.
Everybody ready?
Zach, you already know.
All right.
Please take
Our
math off.
categories are. This was probably going to be the last category that's picked, I'm sure. We got ABGs. All right. You got to interpret that ABG for me. More detail, the better. Generalized mechanical ventilation questions. We got gas exchange, math, and then old content can be whatever.
Oh, Lord.
Just a hodgepodge of different things. This is how your test is set up. This is the type of questions that we're gonna see, okay? I'm putting this out as well. Please don't change the formatting or it messes everything up. So if you download it, you gotta play it this way, okay? Otherwise, it gets way out of whack, all right? Everybody ready?
Ready.
Okay. Grinches. What's your category? What's your poison?
Gas exchange. Alright, we're gonna do gas exchange for 1,200.
Gas exchange for 1,200. All right, we're starting off bold. Do not hit the buzzer until I finish reading the question, all right? A patient with ARDS has a PaO2 of 55 while receiving 100% FiO2. What does this finding indicate? Natalie, what you got?
Okay, so severe.
Severe ARDS. You would be correct. All right, so plus 1,200. Good job.
Sorry guys, that buzzer keeps really going.
Remember, when I'm doing my PF ratio, it is my PaO2 over my FiO2. So it would be that 55 over that 100. And so anything below 100 is going to be severe ARDS. Your moderate ARDS is that 100 to 200 range. And then you just have the basic general ARDS, which is going to be above 200. Okay? Well, you're still in charge of the board.
Me?
Grinches, yep.
Gas exchange for, what do ABGs for 1,200?
ABGs for 12.
Oh, I was asking, are you through that?
You're driving the boat. You just go.
I was asking.
ABG results, pH 7.36, CO2 of 48, bicarb of 28. What is the correct interpretation?
I'm so sorry, that's really bad.
Keep on in.
I tried to like hide it, and then my
Natalie, what do you got?
we have respiratory acidosis.
Can you be more specific?
Yes, I can. It is uncompensated.
Uncompensated.
Wait, no, it's uncompensated.
Okay.
Wait, no, is it?
Minus 1,200. All right. Anybody else want to?
It's partial.
I meant to say partially. It's fine, guys.
Ooh, that's a lot. Was that y'all I hit it up in the back? No. Was it Drew? Okay.
Compensated respiratory acidosis.
I hear fully compensated respiratory acidosis. The whatever's 1,200.
Oh man, I'm sorry, that's my bad. I didn't realize the pH was wrong.
Fully compensated respiratory acidosis.
Wait, we lost 1,200?
Yes.
How does this game work? It's from the 90s.
Have you never seen Jeopardy?
No.
Oh my.
All right, whatever is you are in charge of the board.
We'll take math for 800.
Well, darn.
Math for 800, all right.
All right.
A patient weighing 70 kilograms is receiving dopamine at 400 milligrams into 50. D5W infusing at 15 milliliters per hour. How many mics per kg per minute is the patient receiving?
Hold on, I almost got it.
Who's that? Natalie?
Okay, what do you want it rounded to? 5.7?
Let's do the hundreds. Let's do the hundreds.
Hundreds?
Mhm.
Okay. 5.71.
Okay, good job.
Sorry.
Everybody else got 800? Sorry, not 800. Everybody got 5.71?
I just got
still
it.
working.
Yeah, it takes me a while.
Does everybody want to keep working on it?
Steve, you should probably.
Do we need to talk about it? Can we talk about it?
I saw you talk about that.
Hopefully I can do this because I haven't actually worked this part on them out fully. So we'll see what happens. All right. So let's go. And then he has a D5W of 400 milligrams into 50. How many mics per kg per minute? So I'm looking for mics per kg per minute. And so when I'm doing this, how I like to do it, I don't do dimensional analysis as much. I kind of do a hodgepodge of different things. So just bear with me. Please don't let my way confuse you on the way you do it. Please do it the way you do it normally. So first off, I like to see how many milligrams an hour my patient is receiving. So I'll do, usually what I'm gonna do is 400 milligrams divided by 250. So that's how many milligrams per mil that I'm getting. Which is 1.6. So my patient is getting 1.6 milligrams every 1 milliliter that he receives. Now he's getting 15 milliliters every hour, so I'm gonna times that by 1.6 milligrams. And then I get 24. So he's getting 24 milligrams every single hour, okay? But I'm also trying to get mics per kg per minute. So I gotta times it by 70 because he weighs 70 kilograms. Which is 1,680 milligrams per kilogram per hour. Now here's the tricky part. I gotta divide it by 60 to get rid of the hours and make it to minutes. So when I divide that by 60, hopefully it's 5.7. It is not. I did something wrong. All right, we'll get it later. Good grief. I did something wrong.
Welcome to our.
Oh, no, that's
Because you gotta go from milligrams to micrograms.
That's right. Yeah, thank you. I know I was doing something wrong. So let's see. Let's go back up here and do this one. Should be 1,600 micrograms. Okay. Per 1 ml. Okay. And then as I do 15 mLs times 1,600 micrograms, I get 24,000. And then I want to divide it by 70. That's my other issue that I had. So divide. There There we go. And I get 342. I'm gonna divide it again by 60, and I get 5.71. There we go. Thank you, Meredith, for that.
Start calling you Rain Man.
What does that mean?
Definitely 5.7.
Slow down. You don't want me to. I just like to win.
We'll win.
All right, Grinch's control the board.
Alright, what do you guys want? I'm just
Stick with math. Go
All right.
with others.
Let's do math.
You're doing it.
1,000.
Math 1,000.
Yeah. Okay.
121-pound patient is on dobutamine. 500 milligrams and 250. Normal saline is running at 20 milliliters an hour. What is the dosage in mics per kg per minute?
Well, at this point, just don't even try to attempt to work it out.
I mean, I could.
What you got?
12 point, what do you want, 100?
Yeah.
12.12.
12.12. I like it.
Definitely 12.1.
Sorry, guys. I went to math tutoring. Did y'all go to math tutoring?
You went to what?
Math tutoring.
I'm taking you to Vegas.
All right, everybody else, keep working.
Like, we are not even anywhere.
I got there, but I can't do it that fast.
Okay, that's fine. No worries.
Just leave the math section to, you know,
Can we, like, null and void Natalie, so the rest of us actually?
I feel bad. I can't help it.
No.
This is just what the Lord gave me. It's
Grinch's, what you got?
12.12. Oh. I said, okay. We'll do math for 1200.
Everybody but Natalie. Let's do everybody but Natalie.
Oh, that's not good.
Okay. The
That was a good win.
physician orders 10 mics per kg per minute of a medication drip. The bag reads 125 milligrams of the medication and 60 mLs of IV solution. Client weighs 95 pounds. How many milliliters per hour will we set the infusion pump to? Natalie, you can't hit the buzzer until one of your teammates says the answer. Can't tell them the answer.
I feel like that. It's so cheating. It's nice to be able to work it out slowly. I got it.
I'm telling you.
Right.
I'm gonna get some number.
So Brian didn't work that fast.
The pressure is on.
I didn't tell them the answer.
12.43.
Hold number.
Oh, what was it? 12.
No, that is so,
That's just going off what you're going off of.
Yeah, I guess if we are doing Jeopardy rules.
Well, it is.
Well, technically, 12.43 is wrong.
Okay.
Oh.
The deviated tricks, what do you have?
12.
12, you would be correct.
Oh, is this the Oklahoma Reds in here? Please.
Wow.
I got disqualified.
This is Jeopardy.
I couldn't get out of the answer 5 minutes ago. Bring on my paper.
I just went off what you did last time.
You gotta read the question, guys.
I had the answer written on my paper 5 minutes ago, but I got disqualified.
I just got the answer.
Right, so.
Oh.
Just got
I
there.
just now.
See?
I got it. I got there.
Deviated tricks, you have control of the board.
I did.
Mechanical ventilation, 1,000.
Mechanical ventilation, 1,000.
Oh, I'm sorry, that's
Disqualified. Alright.
I'm already
Patient
disqualified.
is paralyzed with vecuronium for ventilator synchrony. Which nursing action is priority? Are we gonna allow her to answer?
But that is just so not fair.
Everybody says no, okay, alright, majority rules. Alright, what you got?
Sure, stuff.
B, ensure sedatives and analgesics.
Sorry, I don't know what.
Was it-
think it was both of us.
I think it was them, we're gonna go with
Oh.
that. B, that's the right answer, good.
Jeopardy.
It is, I was gonna answer that.
It's like Auburn football.
What was that?
We like cookies too much over here, guys.
Ensure sedatives and analgesics are administered. Remember, with your vecuronium, they've got to be on some type of sedative effect, and they also have to have some type of pain medication. Your vecuronium is a paralytic, it just paralyzes. You don't want your patient fully awake and paralyzed. That's torture. We don't want that to happen. So we're gonna make sure they're fully sedated as much as they can. So we're gonna max everything out. And then make sure they are full pain management. So usually it's gonna be something like propofol and fentanyl on board of everything else. And then we're gonna push the paralytic. Make sure they are on the ventilator. There's no other options for paralytics. You've got to be on the vent. Otherwise, you're killing your patient. All right, you are pretty much destroying their respiratory drive all the way, depleting it. So you've got to be on the vent if you're gonna have these types of sedatives and paralytics and stuff like that. So triplets, I guess you have more.
Can we do old content?
Old content for 400. Old content, what?
Yes, yeah.
A nurse hears a rumbling apical diastolic murmur in a patient with a
Josh did it. You were supposed to wait till he finished.
with a history of rheumatic fever. This finding is most consistent with, y'all can't answer, you already. Natalie's got the board, what you got?
Mitral stenosis.
I hear mitral stenosis, I like that one.
Glad I can find the answer, guys. It's not like I get the last two O-line taken over.
She is taking this serious. Apical murmur, remember, that's the apex of the heart. So down there in the fifth intercostal space, left mid-clavicular line. Diastolic, what is opening, what is closing during diastole? Your mitral valve is opening, right? Because it's between the left atrium and the left ventricle. As it opens, so we have a mitral stenosis, okay?
My stomach's rumbling. And that is the.
Natalie, or the Grinches, I'm sorry. Control the board.
What do you want?
I like old content.
Alright, let's do old content for 600.
Old content for 600. Please remember to not hit the buzzer until the question is read.
I'll just follow directions.
A patient with aortic stenosis is prescribed nitrates for angina. Which concern should the nurse anticipate?
C.
That would be incorrect.
I think it's A.
That would be incorrect as well.
B.
Severe syncope. Remember, nitrates are going to vasodilate out. It's gonna overall decrease my blood pressure.
I should've
In the
been
short
more-
term,
more
I may
about
have some orthostatic hypotension, okay?
No, I'm just saying. I should've-
so with
I
that,
should've- I thought.
I can mark this one out.
I don't want it, please.
Narrow pulse pressure, remember, that's like 100 over like 99 blood pressure. My systolic and my diastolic are real close together. Preload, how much overall volume my heart is fixing to pump out, okay? But overall, I'm vasodilating out, decreasing my blood pressure. So that was y'all, right? Deviated traits, got 600.
Everybody else minus 600.
Grinches, minus 600. Triplets, minus 6.
We're negative. I forgot it worked like that. Nobody told me.
The whatevers, nothing, you're good. If you don't answer, then you stay the same.
That was a great story.
You like that?
Alright, deviated traits.
Oh, content, acres, please.
I hear old content for 800.
Thank you.
During a code, a patient's EKG shows torsades de points. Which medication?
Out of here.
Which medication should the nurse anticipate administering? Deviated traits.
See.
C. Mag sulfate. That's correct.
Something broke my thought.
Cause you wasn't gonna hit it back.
You're gonna make sure I.
Yeah, I gotta help you out, you know. Good co-parent. Period. Old content 1,000.
Old content 1000.
Is this stuff gonna be on the test possibly?
Potentially.
I think so.
A patient with septic shock remains hypotensive despite IV fluids. Which medication is recommended as first-line vasopressor therapy?
It didn't go until after you were done. I was letting her know I was ready. D.
They press the buzzer right here.
I said, no. They don't press the button until after.
I don't want the buzzer, Chuck's in
It's,
front of the
answer is
buzzer.
D, norepinephrine.
Yeah, just give it to them.
Okay, alright.
We'll let them have it.
D, norepinephrine is gonna be my first line.
Nice to the elderly.
Okay.
Hey, we got 400.
Epinephrine, vaso, and dopamine are all other vasopressors, but my first line choice is gonna be the norepinephrine. Okay? Grinches,
Oh, for 12.
old for 12. A patient with mitral regurgitation presents with S3 heart sound, JVD, and hepatomegaly. What complication is most likely developing?
Hit it, Chuck. Hit it. What is left-sided heart failure?
That would be incorrect.
Can we answer again?
Who's that back there?
What is right-sided?
Right-sided heart failure. Perfect.
I would like to argue that right-sided is usually preceded by left-sided.
Valid argument, but I will not take your argument.
Okay, thank you.
Anybody need a break, or are we going? We're good. We're gonna keep going. Whatever's, you're only answering 1,200 questions apparently, so, what you got?
Who's winning right now?
Great question.
Okay.
It's 1,800 to 2,800, minus 6, BB 2,200, 50,000. Looks like the deviated trace.
Period, with 2,600, I think. Someone here? Yeah.
Whatever's, what you got?
Do mechanical ventilation for 1,200.
Mechanical ventilation for 1,200. After extubation, a patient develops stridor. What is the nurse's priority intervention? Those are right on the money, like together.
You can have some money.
Half the money. Alright, so let's say it out loud, I guess, between all two.
C.
C, okay, everybody got C. I like C, notify restore therapy and prepare for receiving epi.
So we have to split this down, and do we get 600?
I mean, that's not how it works in Jeopardy.
But you said first, first.
Let's give everybody 12, how about that?
Everybody, meaning everybody, all four groups.
Everybody answered at the same time, everybody hit the button on pretty much the same time. I mean, I can't.
I mean, that's fair too.
We love you, Sam.
We can,
My nigga loves being nice.
we can add some competition to this. We can put the buttons at the very top row.
And somebody has to
I'm
run.
not
bottom.
running
And I
for
won't.
I feel like that would be not great for us. Somebody would need CPR, so.
Somebody. I mean, you can just CPR by sitting on the
Yeah, that'd be nice.
So who?
So who?
I guess it's gonna be the moderator, I guess.
What does receiving do? The receiving cap?
Receiving epinephrine is to vasoconstrict and open up that airway.
What's the difference between that and regular epinephrine?
The way you administer it. Usually you can put in a nebulizer treatment and it opens up that airway.
Sounds like a respiratory problem to me.
What?
Not our problem.
It should be your problem. Don't think about it as just a respiratory.
How does that open? Yeah, how does that open?
It's just opening up those bronchioles, that's what it's doing.
Cause it's vascularly, it's constricting everything else and causing everything to go towards.
It's just, yeah, it's just.
It probably works like Afrin works in your nose.
Yeah, very similar. Okay, what do I like most?
Well, who's picking up what you?
Let's do ABGs for 1,000.
That's the devil.
Okay.
ABG results.
Damn.
pH 7.28, CO2 of 30, bicarb of 18. What is the correct interpretation? I think the two of y'all said it before.
Definitely is.
I wouldn't finish reading the question yet.
Uh,
I would say, what is the correct interpretation?
Oh.
Too many points.
Well,
Okay, so,
Alright, so these two are out, alright.
Sorry.
huh?
You don't have to answer if you don't want to.
Okay.
But you can answer.
is there a time limit?
Hit the buzzer.
It's metabolic acidosis and it is not compensated.
Okay, incorrect.
Is it partial? How is it partial then?
If you want to.
Metabolic acidosis uncompensated?
That's what they said.
It's partially. How is it?
No.
Well, we can't answer.
You can't answer twice.
Y'all are out.
Alright, we're not gonna give any points for this one, but
It is.
I'm not answering this on points.
Harsh.
partially compensated what?
Metabolic acid.
Metabolic acidosis. Okay, good.
We have half points.
Can you do that on the workforce?
It's because
It's close enough.
the CO2 is under 30.
Alright, pH is 7.28. Is that high or low?
Low.
It's low,
I
right?
guess it would be normal if it's not uncompensated.
CO2 of 30.
It's low.
It's low. Okay, good.
Messed it up, I'm sorry.
Bicarb is 18.
Low.
Low. Alright, now, can I have my pH and CO2 pointing the same direction?
No.
No, right? So it's gotta be metabolic in nature, right? Alright, is my pH alkalotic or acidotic? Acidotic, so it's metabolic acidosis, alright? Now, is my CO2 changed?
Yes.
Yes, right? It's going down. To compensate, right? for my pH level, right? Is my pH back in normal range? No, so it cannot be fully compensated fully compensated metabolic acidosis. It's got to be partially compensated metabolic acidosis, because the lower my CO2 level goes, the more alkalotic it gets, all right? The CO2 is trying to get more alkalotic to hopefully buffer this pH level to go back up, okay? Now, for your metabolic conditions, this one's gonna be pretty easy to remember. All your arrows are going down, partially compensated metabolic acidosis. All your arrows are going up, partially compensated metabolic alkalosis. Okay?
I remember you saying that in the lecture. All of them down.
Does that make sense for everybody?
Yeah,
Okay.
it didn't come to the forefront, okay.
So y'all were wrong, right?
Yes.
Triplets minus 1,000. Whatever's minus 1,000. Alright. We're not gonna give you any points in general. Okay.
We're going to excel in this
Sorry, that was kind of louder than I thought it was.
It was.
Josh, don't press nothing.
Remember the Jeopardy policy, no foul language?
You know, I never watched Jeopardy, but I feel like, you know, Steve Harvey, they think we kind of found.
You're not, okay. Watch an episode of Jeopardy and see the kind of contestants, no offense to them, but they are very dirty, so they are.
Oh, well, that might be why. I watch Steve Harvey.
I do like Steve Harvey though. Alright, let me pick again then. Let's do gas exchange for 1,000. The nurse is caring for a patient with ARDS who is in the prone position. Which complication is most critical to monitor for? I got Drew on the end. Whatever's what you got.
What is B?
Airway obstruction or accidental tube dislodgement. Perfect. Increase urine output. Does that really matter?
No.
That's probably a good thing, honestly, right? Decreased ICP. We didn't talk about ICP, did we? So don't put ICP, okay? Hypertension. I mean, they're gonna be a little hypertensive at times, but the biggest thing, remember, prone positioning. If they're in prone positioning, more than likely they're gonna be on some type of sedative, some type of analgesic, and on some type of paralytic. The biggest thing, biggest complication when flipping them all the way over on their stomach is any type of tube dislodgement, any kind of central line dislodgement. There's a lot of extra stuff that's attached to your patient that could potentially get pulled away, okay? So airway obstruction or accidental tube dislodgement. Good job, whatevers. So that was 1,000. Y'all have control.
Huh?
We do gas exchange for 800.
Okay. Short introduction, hold on.
Announcer has.
You said 800?
Yes.
Gas exchange for 800. A patient is a post-lobectomy. Which position is most appropriate to promote ventilation perfusion matching? Bridges?
On the opposite side of the incision
Can you be more specific?
was the left lateral. I don't know which side of the
Depends
leg
on.
was on.
Be a little more specific. What you think? You said what was your first statement?
The side that's affected.
They would lay on the opposite side of surgery.
Opposite side of surgery. Okay, perfect. Non-operative side down. Good job. Grinches, 800.
It took me a minute. The hamster had to spool up. But it got it.
I'm trying to give everybody else a chance. I'm having all.
Grinches.
What do y'all want?
Oh, math for 600.
Obviously, you cannot pick this one to the very last one, so just throw that out there.
Alright.
Math for 600.
Okay.
Do we need to allow Natalie on this?
No, she's fully participating.
I mean,
I don't want too, y'all got it.
Natalie,
Natalie,
we love
we
you
got
so
it.
much, but you're really fast.
Y'all got it, y'all got it.
I mean, it's really not that serious.
I don't get it.
Natalie, go ahead.
Just a game.
Patient weighing 60 kilograms on epi 4 and 250, infusing 10 milliliters an hour, blood dose in mics per kg per minute.
You got it,
Wrenches,
0.04.
0.04, perfect. So is math gonna be important on this next exam?
I sure hope not, because you
I
said
really-
first test it was gonna be heavy and after that, we didn't have to worry about it that much.
Okay, there's gonna be a few questions on there,
I
alright?
think it was just two, I could miss 4 points.
Right? I'm gonna say I'm on.
You gotta be perfect on the other stuff then, alright?
I think I got it.
Okay.
Oh, God.
You got it, Sam.
Grinches, got control of the board.
Stick with math.
I just wanna make sure that I
And
get it.
math
Amen.
for 400.
Can it just, can you put like math for like the drip? I can get that with no problem.
I ain't got no groups on here. Orders for 1,000 normal saline infused over 8 hours. Using an IV pump, what is the infusion rate? Natalie,
125 milliliters per hour.
125 mils per hour, correct. Good.
I tried to be slow. This is my slowing down.
Math for 200.
Math
We're getting
for
math
two.
out of our life.
I don't care. I'm letting my friends.
Everybody ready?
Yes.
Orders for amoxicillin, 250 milligrams PO. The medication is available in 125 milligram in 5 mil.
He didn't finish.
Oh, he did not finish that.
125 milligram, 5 mil suspension. How many mLs will you administer? Ooh, that was like the exact same. Well,
Ours
actually,
ended first.
theirs did end first, so
Are these buzzers calibrated?
they are kept.
No, 10
Well,
ml. 10 ml.
All right, 10 mLs an hour is wrong. Drew, 10 mLs, perfect. All right, triplets, 200, perfect. Old content for 200. Which valve is located between the left
Oh,
atrium and left
I
ventricle?
really hate this buzzer, because that's how my brain works.
I feel like this one's a little bit longer over here.
Go ahead. Just fine.
Let's go.
You ready to wait for me?
Let's go triplets over here, I think. Mitral valve? Right, good.
Get him out of the hole. Y'all need to borrow some money?
Can you talk trash there different?
I mean, you're free to speak out. ABG's 200. A nurse reviews the following arterial blood gas results for a client. pH 7.4, CO2 of 40, bicarb of 24, PaO2 of 95, SaO2 of 98%. Which interpretation of these results is most accurate?
I I mean,
Ours went off first.
We need some more money.
I feel like I saw Natalie hit it first, honestly.
This is
Riches?
a normal ABG result.
That is correct.
I waited until the very last question mark on that one.
Grinches.
Well,
It doesn't matter at this point.
These are messy, but they're really good.
we can do ABGs for 400.
I hear ABGs for 400. ABG results, pH 7.30, CO2 of 50, bicarb of 24. How would the nurse interpret this? Grinches.
Uncompensated respiratory alkalosis.
Respiratory alkalosis.
Oh,
Incorrect.
It's all
Did y'all hit the button?
No, we did.
Let's go whatevers.
It's uncompensated respiratory acidosis.
Perfect.
It's the only question
We didn't know that. That was my only problem. I was like, man, these don't have lines. You get what you pay for. They were 70 cents. So there you go. Still.
That's always.
Whatevers.
ABG's for 600.
ABG 600. ABG results, pH 7.50, CO2 of 38, bicarb of 30. What is the correct interpretation? Grinches.
It's uncompensated metabolic alkalosis.
That is correct.
I just don't say it like that time.
Uncompensated metabolic alkalosis. Grinches, you have control of the board.
We could do mechanical ventilation for 400.
Mechanical ventilation for 400.
Is that good then?
A patient's ventilator is alarming for high pressures. Which is the most likely cause?
okay, Mr. ICU.
Deviated trachs.
I'm gonna go with B.
Patient biting on the ET tube. Correct. Remember, anything with a high pressure alarm is going to be biting the tube or some kind of kink in the tubing, some type of mucus plug, anything where the ventilator is having to work harder to ventilate that patient, to deliver that breath of air, okay? So that was 400. Deviated trachs.
Let's do mechanical ventilation for 600.
Mechanical ventilation for 600. Patient has ABGs, pH 7.25, CO2 of 65, bicarb of 22. The ventilator alarms for high pressures. What is the priority action? Your buzzer has given up on you, the Grinches.
Administer 100% oxygen.
Administer 100% FiO2. That is incorrect. Deviated trachs. A. Suction the patient for possible secretions. Good. Correct.
Cause you just said that. You did, you said mucus plug. Bear does not like the word mucus plug.
Let's tone it down just a hair. Let's be a nice friendly game. Okay. Remember, this isn't high stakes. Okay. Mucus plugs. Any type of secretions. I'm trying to get that out. All right. I don't say anything about FiO2 in here or PO2, so I wouldn't do this initially. Okay. My priority concern: the ventilator is alarming for high pressure. So what do I need to do about it? So if my patient was biting the tube, like the question before, maybe some therapeutic medication. That doesn't work ever.
Sedate them.
Sedate them. That's our fun one that we like to do. And then make sure there's no any kinks in the tubing. Nobody put some hemostats on your endotracheal tube, which would never happen, but who does that? Who knows?
You know.
But also secretions, mucus plug, that kind of stuff. Okay. What's it, deviated trachs? What you got?
We'll do mechanical ventilation for 800.
Mechanical ventilation for 800. A patient on mechanical ventilation is sedated with propofol. Which nursing consideration is most important? Let's go with triplets in the back over there.
D.
D, monitor triglyceride levels and airway status. All right, triplets. The most important thing, really, airway status, all right? They're on a sedative. They're supposed to be on the ventilator. So if you walk in that room and the endotracheal tube is in their hand because they're wide awake, that propofol is not working like it should for one, because they can still be fully awake on the probe. But your airway status is gone. Then you have to reassess. Make sure your patient doesn't need to be reintubated. Maybe you can just go on a BiPAP, something like that. Make sure your airway is patent. Propofol is made with fats, lipids, so that's going to be your triglycerides as well. Okay.
We're gonna, do mechanical ventilation for 200.
All right, I'm going to close out mechanical ventilation. Which ventilator setting is responsible for keeping alveoli open during expiration and preventing atelectasis?
It ended
Oh,
before
definitely.
theirs.
Nah, I don't know about that now. That was a group effort. I've always said out loud, we'll give it all.
P in expiratory pressure.
You're not getting it because you hit it before, but yeah. These two groups right here. Peak, go ahead. Peak in expiratory pressure.
So we both get 200?
Both get 200.
Yeah.
I hit it.
I am.
No, we didn't put it. No, we didn't. No, we didn't.
Alright, whatever is in deviated trachs, pick a category together.
Gas exchange, 600.
Y'all go with that?
Sure.
Gas exchange, 600. Which chest tube finding requires immediate intervention? I think the Grinch has got that one.
C.
I hear continuous bubbling in the water-filled chamber. I like that. 600. What are we gonna do about that?
Check for an air leak, and if you don't
Assess.
find an air leak, change the HRM.
Assess, right? Start with the patient, work your way down.
For D, is that not an issue too? Just curious. Like, does that mean they're just good?
They're healed.
They're
It's like a clot or something.
The most immediate intervention is gonna be the continuous bubbling. That's what I'm most concerned about, because it's introducing air into the system. Either they're healed, or you do have a clot, or someone puts some hemostats on them. So. All right, Grinches.
I don't care, ABG's for 800.
ABGs for 800, closing it out. ABG results: pH 7.47, CO2 of 32, bicarb 22, PaO2 of 55, SaO2 of 86. What is the correct interpretation?
Why did I say it?
You wrote it down.
Do I have to include the compensation or just regular?
I think
I
my
will not
buzzer
be
said,
specific on the answer.
I hit it, but you can hear it.
It's respiratory alkalosis.
Hit it again.
800. All right, can you be more specific?
Serious, like,
Uncompensated.
serious, I know you hit it.
Uncompensated what?
Respiratory.
Uncompensated respiratory alkalosis. Good. Correct. Any questions about that one? Good.
I ain't reading that.
Deviated trace.
Gas exchange 400.
100. There's no 100 on
I
it.
said 400.
Oh, okay. So 100. A patient with an open pneumothorax from a stab wound arrives in the ED. What is the nurse's priority intervention? Let's go whatever. So we got
What is B?
B, apply 3-sided occlusive dressing. You would be correct. Awesome. Why?
She don't want to.
That's not part of it. Suck it in air?
Yeah.
Okay, good. Remember, it's an open wound, open pneumothorax. Some kind of outside trauma has penetrated my pleural space, my pleural cavity right there, creating that nice open wound. So it's kind of gushing that air in. I want to put that 3-side occlusive dressing on it, so as I'm inhaling, it sucks it tight, hopefully preventing air from coming in. And then as I exhale, it's pushing it back out, creating that kind of valve right there, okay?
So like this is probably out of question, but do hospitals not carry like bowling seals or anything like that? It's just like,
Some of them do, I'm sure, some of the big major facilities. If you,
They're probably way too
cause we're not,
expensive.
we're not taught 3-sided.
Yeah.
Like that's kinda, some of them are printed, you know, so that's why I was curious.
And they're easy to just slap right on.
I'm gonna bring some.
probably Detroit, Chicago, the big major
Places like that.
cities that are gonna get a lot of that type of stuff.
Level 1 trauma center.
East Alabama Medical Center, you're gonna do some 3-sided too. Whatever, we got gas exchange for 200.
No, I want that one.
Emergency treatment for attention pneumothorax.
That was literally us.
That
I
was,
feel like Hannah got really close to it
I
on that.
think
She
we
was,
were all really close.
I mean, everybody was right on the money.
My buzzer gives out.
So we all might as well just say you're listening to get 200 points, 200 points.
Yes.
All right,
Needle decompression.
good.
chest compression.
Everybody gets 200.
Chest
Yeah,
compression.
oh, sorry.
Chest.
My bad. My
Minus
bad.
200. Needle decompression at the second intercostal space, mid-clavicular line.
Just teach you to see stuff.
Is it gonna be that specific or just like, we'll have to know?
Probably not.
Okay.
Probably not. And honestly too, if you see needle decompression, I'm not gonna say second intercostal space, third intercostal space, fourth intercostal space, so. Okay,
So who wants some more?
let's tally up our points here.
We're at
I'm really
6,000.
sorry for the left-sided. I think it was the left-sided precipitated
We're-
right-sided.
Just
so
ask
it's-
Natalie, she can,
Yeah, we're 2,800, I think.
where you
it's
at?
unlockable.
No, well, I think there were times I hit the buzzer that it went, like I could get, I was sitting at weird, so it's not bad. I didn't know that one that you asked about it, I had no clue.
I really think she could go to Vegas and make some money, for sure.
Natalie, you're gonna have to
They're never
teach
gonna
me how you
make
do
it.
those math questions.
So, you're all paying,
Because they
I
told me
cheated,
that.
that's all.
Yeah, no kidding.
Huh?
You get about like 10 minutes if you could do them that fast.
I'm just saying, like.
Wrenches, 4,600.